looks like I'm having a bit of a technical difficulty. Let me check something.
Sure.
For anybody that's live, apologize for that. For anybody who's watching us. Looks like I'm having a bit of a technical difficulty. Let me check something.
Sure.
For anybody that's live, apologize for that. All right. Anybody who's watching us. Okay, I think I have the technical issues solved there. And it looks like we're live, Paul, so apologize for a little rough start. So this is Howard Owens, published with the Batavian. We're doing another live stream interview. We haven't done one of these for a while. In fact, the last one we did was with you, Paul. So we're having our healthcare director, Paul Pettit, on today, our director of public health. So thank you for joining us, Paul.
Absolutely. Glad to be here, Howard.
Good.
Happy New Year.
So, well, first of all, there's a press release yesterday. Let's just talk about the change in sort of the protocols for, isolation and reporting positive cases and contact tracing.
Yeah, so midweek last week, the state put out some updated guidance, right? So I think the date on the guidance memo was January 4th. This change was in line with some of the changes we've been seeing from the CDC over the last few weeks. So the state finally had moved forward with trying to get, in alignment with CDC guidelines as best they can, which is something that we welcomed on the local level because it creates a lot of confusion when we have differing guidance coming out of the CDC and the state. So essentially what happened is we went to, again, 5 days for isolation, 5 days for quarantine in most cases. Again, if you look at the guidance document and what we put out there last Friday in our press release, there are specific criteria. Again, those folks after 5 days of isolation, they should either be asymptomatic at that point or symptoms improving. If not, they should remain in isolation for additional days, pending those symptoms until they start improving. Again, we still want to see people wear masks, well-fitting masks after they leave isolation up to that 10-day period. So even though they may be getting out of isolation on day 5, they would still continue to wear that mask anywhere in public through the remainder of that additional 5 days. Those that are severely or moderately immune compromised, again, we'd like to see those folks stay in isolation up to that 10-day period, again, due to their sensitivity and just the disease course potential due to their comorbidities. And then individuals unable to wear a well-fitting mask after 5 days should also follow that typical 10-day isolation period. So in general, most folks will be able to get out of isolation after 5 days. But again, there are a few caveats. Similar with quarantine, the updated state guidance has been changed a little bit, again, to follow that 5-day time period. So following day 0 after exposure. So if your last exposure to a positive was 3 days ago, you're already 3 days into it. So you'd only have 2 additional days of quarantine. But again, the state still has those caveats there. One thing to note, if you're not vaccinated, just like the previous guidance, you would be under that 5-day quarantine. In addition, now, if you're eligible for a booster but not yet fully boosted, the state has changed the guidance that you should quarantine for that 5-day period. So that is a change. Before that, fully vaccinated did not include that booster. But if you are fully vaccinated and boosted, you no longer would have to quarantine for that 5 days after that exposure. So again, there's a little bit of nuance in some of those changes, but those are the highlights there. The other big thing that occurred that we put out in that press release, which I'm glad we're talking about because it is kind of hard to explain this in a press release. We are changing the approach on contact tracing for the general public, mainly the ages 19 to 64. And this, again, is something that has been done by the state. They're in the process of changing that over. And a lot of that has to do with, obviously, the extreme spread that we're having right now across the state with the high number of cases that we're seeing due to the Omicron variant. We just cannot keep up with the isolation and quarantine that we've been doing for 22 months now or so. When you have such high community spread, we're not even getting to the positive cases, those with disease, within 2, 3, 4 days sometimes, because that's such the backlog, right? So We're moving to a phase where we're, putting more of an emphasis and trying to triage response and make sure that we're getting those with disease isolated home, obviously not out in the community, potentially spreading it, but we can't get to all these contacts. So essentially what we're doing is, again, triaging, trying to use our resources as best we can to make sure we're hitting the highest impact areas, which are the positives first. And in doing that, what we've done is we've added all of our isolation and quarantine orders, and we've added our release letters to our website. This is something similar to what Erie County's had for a little bit of time now. Some other counties around the state that started doing this. And I think you'll see most counties probably in the state doing this over the next day or two. But we're essentially moving more to a self-service mode here. So essentially, if you have been exposed to somebody as a contact, you will then go on and download your quarantine orders. And then after that 5-day period, you would then download the removal or the clearance from quarantine letter, which is what you can then use to give to your employer. You can use to give to school at that point. But it's going to be more of a self-service again, just due to the amount of work that's we're trying to deal with right now. So, excuse me. So there are some changes that are occurring, which again, in my opinion, is moving us in the right direction. We've talked about this since last fall, actually late last summer, moving more towards an endemic model of respiratory illness. And I think some of these changes that the state is now doing are helping us to move that direction. Do we still want people to isolate? Yes. If you're positive, you need to isolate. You need to stay home for a minimum 5-day period to again make sure we're not exposed to other folks. If you're exposed to this contact, we want you to quarantine. Yes. But again, there's going to be some self-service, self-responsibility here to make sure you're doing that. We know it's not a perfect system. We know there may be people that maybe won't do that. But ultimately, this is the way that we're able to move forward and still be able to triage our response.
Great, Paul. Thank you. I was working on some technical issues there at the end. So you mentioned Omicron and kind of, we're reading a lot about the surge nationwide. Where's Genesee County kind of relative to what's happening with national trends, particularly in regards to Omicron, but, coronavirus in general?
Yeah, so we definitely started to see the impact of Omicron locally. We do have it confirmed. We have identified and isolated out Omicron in Genesee County. So we know it's here. Some of the most recent data we're getting back from the state now, who's doing stereotyping of the different variants, is showing that 85 to 90% of all cases in the rural areas are Omicron currently, so that number continues to grow. It does mirror and is very similar to what we've seen around the country as far as Omicron becoming the dominant variant. So we are dealing with it. We are seeing it occurring. Omicron variant is spreading very easily and quickly. We know that it's very infectious, much more so than Delta and the earlier strains of COVID. So with that, it obviously spreads quicker. We also know that we're seeing more breakthrough infections, and this variant is doing a very good job at evading the vaccine ability to keep you from getting COVID. It's also evading natural antibodies, so those folks that have had COVID previously, whether it was Delta or an earlier strain, we're seeing those folks coming down with Omicron. So we do know that it's a little bit different of a makeup, but the good news is that it's not as severe. Even though we have record number of cases over the weekend from last Friday, we had almost 500 confirmed cases in Genesee County. We have less folks currently in the hospital with COVID than we did, a month or two ago when we had less numbers, but we had more folks in the hospital with the Delta variant. So although we have higher numbers, the good news is our data locally is clearly showing that it appears to be less severe, but it is spreading easier. So we are seeing a lot more folks getting it. But fortunately, again, those cases seem to be a little bit milder in severity.
We hear a lot about, a lot more milder cases, fewer hospitalizations, but one of the things I've seen recently is, again, these are national numbers, which are, more reliable as far as trends than our small sample size locally. But, the raw numbers of actual people being hospitalized are pretty much the same. Mm-hmm. I'm just wanting to address, I think a lot of times people don't understand, more infections, even though a lower hospitalization rate, when you're having so many more infections, it can still overwhelm the hospital system.
Oh, absolutely, which is why, again, we look at these things typically on a regional level when we look at bed capacity. And, we talk regularly with Dan Ireland over at UMFC, keeping an eye on what's going on there. But it's really a health system issue. When you think about the way our folks in Genesee County engage in health care, obviously we have UMFC in the county, but a lot of our folks end up going to Rochester and Buffalo for healthcare services. And if they need to be admitted to a hospital, we have limited capacity here. So really, we have to look at the bed capacity issue as kind of a system-wide impact and how it's playing out. And you're absolutely correct. When you look at the amount of cases we're having, we may have lower numbers due to Omicron and severity, but just due to the sheer volume. When Monroe County is putting out 2,000, 3,000, 4,000 cases per day, we're all proportional based on population in the 9 counties around Monroe. But it is a concern on bed capacity, which is always been a concern from day one, making sure that we have capacity available for folks that need it for emergent issues. So it is something we're still monitoring and something that we want to closely follow. But in terms of I guess the numbers that we're seeing, at least from those needing hospitalization level care, from what we saw with Delta, we're pleased to see that it's much lower. Because if we were seeing that higher need like we did with Delta, it would even put us in a more precarious situation regionally with hospital bed capacity.
So the maybe any advice for people who may be having it sounds like Omicron sounds a lot like a cold. Is there a way for people to distinguish, or is getting a test really the only way?
Well, it's one of the things we hear a lot. Our case investigators, we talk to people. I talk to people. They call me and say, "Hey, I got a cold." And the problem is, and we've tried to articulate this fairly well all along throughout this pandemic. The symptoms of COVID, are very, very similar to what most people would consider a cold or a mild flu. So really, the only way to distinguish 100% is to go get that test, right? Whether it's the flu or whether it's COVID or some other illness, right? So it's hard, which is why we've been very clear from the beginning. If you have symptoms, if you have a cough, fatigue, congestion, runny nose, scratchy throat, any of those type of things, those are indicators that you're off a little bit, right? That there's something going on. And the only way to really verify that is to go seek out that test, which we know has been challenging, again, with access to testing, et cetera. But the best thing we tell people to do is stay home. Don't go to work that day. Don't send your kids to school until you know. Because, again, that's really the only definitive way to, figure that out. But there's often, a lot of folks we talk to when they're positive, I just thought it was cold. I went and got tested and I had cold. It seems to be a reoccurring conversation we have over and over again.
So, Paul, let's talk about vaccines. How's Genesee County doing on vaccines?
Yeah, so we've, we're ticking up. I wouldn't say we're setting any land speed records here, with getting folks vaccinated. We hit that wall, kind of late summer, early fall, where our increase in numbers really slowed down. Currently we're about 64.1% of our population ages 5 and older vaccinated with at least 1 dose. And we're right around 58.9% that have completed the series. So again, that's 1 Johnson & Johnson or 2 Moderna and 2 Pfizer. So we're still hovering, kind of around that 60% number. If you look at the entire Finger Lakes region, it's a little bit higher. Again, Monroe has a little bit higher compliance than the rural counties around, but I'd say we're pretty close to most of our counterparts in the Finger Lakes region if you look at the rural numbers. But the demand and the folks seeking out the vaccine is definitely, I'd say, plateaued. We do get a trickle coming in. We're still offering vaccination clinics once a week, and we encourage folks to go to our website and sign up. We do have all the vaccines available right currently. So if you're looking for a first dose, a second dose, a third dose, booster shot, whatever you're looking for, we do have those, and we're currently vaccinating Wednesday afternoon. So I would encourage anybody to go sign up for their shot, and we'll take care of you. Currently, we're around 20% in the county with a booster shot that are eligible. So again, we have a ways to go with booster shots, which we know have been shown, at least with our local data, to be very effective at preventing severity. Those folks that do end up in the hospital, that are fully vaccinated. We see a very, very small percentage of them with booster shots. Those are mainly folks that are fully vaccinated that may have completed their series back last January or February or March. So we know over time that the efficacy of the vaccine does drop, which is why we really want to see folks go get that booster shot to get that protection level back up. And it is showing to be effective again at preventing severity.
I want to just make the observation. I had the Johnson & Johnson, and I got the booster, and exactly 2 weeks after I had my booster, I had an hour-long meeting face-to-face with somebody who that evening was symptomatic, and the next day did test positive. I kind of quarantined for 5 days, did a home test at the end of 5 days. I had no symptoms. The test was negative. And I've said all along that the vaccines are safe and effective, and my evidence is anecdotal, but I think that goes against some of the anecdotal evidence that people put out there falsely about the vaccines.
Well, to your your first experience, Howard. I mean, this is something that we have seen play out live in data, right? So it's not necessarily anecdotal. We've seen this in our local data. So when we share these stats, this is stuff that we're seeing locally, and we are trying to track this and stay as factual and accurate as possible. And it is showing currently, and again, things are always due to change, but that the booster shot is very effective at preventing disease, but also preventing severity, more importantly, for those folks that may have breakthrough cases, which still is hovering around 30 to 32% here in Genesee County. So it's higher than it has been, and we've seen that number go up as the need for booster shots go up, but they do definitely correlate.
I think a lot of people don't look at the data. I don't think we've had a chance even personally to talk about this, but we've had a incident here that we covered, former healthcare worker making national news, going out publicly speaking with an anti-vaccine message, at least one church leader picking up on that. When you have local people like that pushing out false information about the vaccine, how much harder does it make to get people to get vaccinated and take it seriously?
Well, it's always a challenge. We've heard a lot about vaccine misinformation and just spreading of different narratives. And anytime you have conflicting messages out there, I think it always creates noise and creates differing confusion, I guess, right, for folks to be able to understand, what they should and who should they be listening to and why. And we've said from day one, and I continue to say this whenever we talk, to the press and push information out, we want people to be informed. It's okay to question things, right? We need to be able to try to understand and make sure we're getting as best the factual information. And we've always, referred folks to do research, to become informed, and to make a decision that's best for them in consultation with their medical provider. We're not giving medical advice. What we're doing is talking about a vaccine. We're talking about the importance and the effectiveness and what the data shows it does, but ultimately everybody's individual health care and their own personal health issues should be discussed with their doctor. And, we've maintained all along that if you have concerns about the vaccine, it's a right for you. Or should you get a booster shot? These are things based on your own individual health needs and health status. You should have those conversations. We've never discouraged that. We always think that people should become informed and make decisions. With that, we want people to refer to the CDC, the New York State Department of Health, different resources that have gathered a lot of peer-reviewed information, that have looked at a lot of studies and a lot of reports on the vaccine. And again, read through those, become informed, and make decisions that way. Not necessarily listening to different, whether it's Facebook, misinformation, those type of things. Seek it out for yourself and then make decisions based on those facts.
Right. Paul, we've covered a lot of ground. I think I asked the questions I wanted. Is there any final message you want to share?
Yeah, I guess I just like to put it out there that, things are changing. Kind of this shift away from contact tracing in most cases probably seems like a pretty significant shift, which I do believe it is. It's something that we're moving away from, that we've been doing for, again, 20 plus months now. But, as we move into kind of this new phase of the pandemic and how we're going to be tracking things and working with folks, positives, those are contacts, we just want folks to make sure, first and foremost, that if you're symptomatic, you're staying home, that, we're going to be asking you to notify your contacts and let them know that you're positive and that they should quarantine. So we're going to more of a on your honor system with a lot of this stuff. And we're going to need people to, be responsible and to make those decisions and to do their part in trying to limit the spread of COVID within our communities. So with that being said, if you're symptomatic, stay home, get your booster shots if you're eligible, get vaccinated if you haven't done that. Obviously, again, our data is clearly showing that it does help prevent severity, help prevent disease, and ultimately will hopefully reduce the spread in our community. But with spread so high, just we can all do our part. If you're out and about in public, put the mask on and do your part to try to reduce spread. And again, what we're talking about is not just cloth masks per se, but some more of the well-fitting masks, especially with Omicron. It's important trying to reduce that spread. So we just are again encouraging people to go out and get their booster shots and continue to stay home. Especially if you're symptomatic, seek out that test. And again, with the high numbers we have, we're expecting that to last for several more weeks. Hopefully, we're going to start to see those numbers come down. But we have a few more weeks to go, we believe, with the Omicron spread here.
Great, Paul. I appreciate your time.
Sure.
I believe that's it that I have right now. So again, appreciate it, and stick around for a minute. I've got something else to share with you. So,
all right. Well, thanks,
Howard. We're gonna end this here. Yeah. So, I don't know. There we go.